Apraxia test. The next video that you will see is a test that I performed myself with one of my patients in order to illustrate certain aspects of his apraxia. As you will see, the test involved the patient performing a number of gestures prompted by the therapist. The therapist and the patient are seated opposite one another, and the patient is required to perform the gestures using his upper limb, or rather that which would be considered the healthy limb, or better yet, that which does not have any problems in terms of motor function. As you will see in the video, however, the patient makes various mistakes when performing and copying the movement. This test serves to illustrate certain specific aspects of the patient's motor alterations, for example, the relationships between the various joints, or the incorrect orientation of the movement itself in space. These are not problems that you need to worry about at this point. I'd like to ask you to watch this test and to take note of the movements that I perform with my patient in order to get a clearer idea of how a cerebral problem does not affect the upper or lower limbs directly, but rather affects the patient's ability to control their movement. Even the upper left limb, therefore, which does not appear to show any problems in terms of movement, is nevertheless affected by a movement control issue. I'd like to remind you that this is a test and not an exercise. You can perform this test in order to get a clearer idea with regard to certain problems and impairments. I generally perform this test in front of family members in order to help them understand that the problem lies not only with the muscles, but that it is a more general and complex issue that must be addressed in a specific manner. If you'd like, you can perform the test in the same manner that I do using a video. In this case, you would record yourselves, and after a month or a month and a half, after having performed a reasonable amount of neurocognitive rehabilitation, you can perform the same activity again, taking note of the differences and the improvements in the manner in which the patient performs the test itself. This issue of apraxia and aphasia in general, insomuch as how I am discussing them, is rather generalized and only serves to provide you with some easy-to-use tools. If you'd like to address the issue more in depth, however, some useful and perhaps even fundamental tools can be found in the test for apraxia proposed by Dr. Perfetti, Dr. Ponte, and Dr. Rizzello, which can be found in the publications entitled Rehabilitation and Learning, Neurocognitive Rehabilitation, and Rehabilitation and Culture, where you will certainly find that the issue is discussed in a more in-depth and professional manner. In this video, I will show you the Dorenzi test, which is used to assess apraxia, a clinical condition that's especially common in right hemiplegic patients. The right hemiplegic patient, in fact, is asked to mimic the therapist's gestures with their so-called healthy limb, or rather the left limb, as if they were to be standing before a mirror. I often use videos of this type to illustrate how a brain injury does not only directly affect the muscles and the limbs in relation to the side that has suffered the injury, but above all the brain functions that allow for the movements to take place. As you can see, in fact, the patient has great difficulty focusing upon the gesture that I'm making and mimicking it properly. The test is comprised of a series of gestures that are designed to address the specific difficulties the patient has in carrying out the movements and maintaining focus. These are difficulties that cannot be taken into account within the scope of the rehabilitative treatment. You can see the difficulties that the patient has in organizing the gesture and in selecting the proper joints to use in order to mimic my movements. These difficulties must be taken into account during the rehabilitation exercises that we will perform in order to help the patient regain the ability to walk and move their right arm to grip objects. Once again, rehabilitation techniques that mainly focus upon the strengthening of the muscles, the passive mobilization of the limbs, and the passive stretching of the muscles themselves will not provide for any significant improvements, as they do not take into account the underlying cognitive difficulties which represent the bulk of the patient's problem. Right now, I'm focusing the patient's attention upon the orientation of their hand, which is different than that of my own. This is one of the problems of a spatial and orientational nature that apraxic patients generally tend to have. Keep in mind that these types of problems can present themselves for all kinds of movements. These aspects must therefore be taken into account when focusing upon the ability to walk or the ability to grip objects. Each of our movements is an expression of a harmonious and complex series of relationships between our joints. For a specific purpose, with this movement you can see how the patient has difficulty using their joints to complete this rather simple gesture. The test requires the same gesture to be repeated various times in order to allow the therapist to assess the patient's ability to learn and likewise their ability to improve the gesture after several repetitions. It should be noted that this is a rather difficult gesture to copy. In fact, it involves various joints and different directions of movement. What's more, the index finger is shorter than the middle finger, and therefore in order to come into contact with the table surface, the patient must adjust its length. In this case, however, we can see that the patient is omitting a number of important elements by only selecting the two fingers and not positioning them properly in relation to the surface. You can certainly imagine how difficulties of this nature would render activities like walking much more complicated. Again, in this case, we can see that the patient has difficulty orienting their body in space. The hand is not oriented properly and is not positioned correctly in relation to the chin. This provides us with yet another clue as to how we can enrich our exercises with this element in order to help the patient improve in this regard. Now, however, we can see another problem that often manifests itself with right hemiplegic and apraxic patients: persistence, which is also present in the case of linguistic disturbances. As you can see, in fact, the patient repeated the gesture that was previously requested. In mimicking this gesture, we are able to see how the patient has difficulty organizing a precise temporal sequence. Our movements, in fact, are always aimed at organizing a precise temporal sequence. With well-organized spatial characteristics.
Questo si tratta di un test e non va confuso con gli esercizi che saranno di natura diversa.
This test must not be confused with the exercises, which will be of a different nature. Rather, this test only allows us to gain a fuller understanding of certain difficulties that are often hidden or remain invisible. These include specific cognitive alterations, difficulty paying attention, difficulty learning, difficulty remembering, and difficulty organizing movements in space. All these elements must be taken into consideration during the formulation of our exercises. And this is precisely why neurocognitive rehabilitation is an essential component of post-stroke rehabilitation.